Hunt, Doctor of Medicine, is a pediatrician, pulmonologist, allergist, and immunologist. Trained in the US Navy and the University of Virginia, he has been Chief Medical Officer or Chief Scientific Officer of 6 companies with yearly revenue ranging from $1 to $200 million. He has also been CEO and CFOs of several other enterprises. He's the Chief Medical Officer of Sedera Health, a medical cost-sharing organization. He's also author of several novels that he's writing with Doug Casey. He has spent decades aware of how health insurance is neither healthy nor insurance. The topic of his speech is Moral Hazard, the third-party payer problem in medicine. Ladies and gentlemen, please welcome John Hunt.
Thanks, Giant. So, how many doctors are here in the room? 1? Anybody else? 2? Okay, I'm only going to talk to you then all day. So, got you covered. And United States versus Canada. How many United States? How many Canada? Roughly split. Okay. This topic will go about 60% US, about 40% Canada. But the ones who are from Canada will have to kind of make extensions from what I'm saying to see how our radically different systems are. So the first thing is going to make a bunch of little points, one of which is, after he goes by, is Charlie Munger, who works with Warren Buffett, you probably all know him, says, show me the incentives and I'll show you the outcome. And that is something that I have lived by. It's how I work when I work with health financing agencies and when I work with individual patients. Show me the incentives, I'll show you the outcome. And if you forget that one thing, probably nothing else you do down the line is going to matter. In the United States and in Canada, that line has been completely forgotten when it comes to the medical system. And I think we need to reinforce that and bring it back. Will we accomplish it? Absolutely not. There's probably absolutely nothing that anybody in this room is ever going to do about the Canadian healthcare system or the United States healthcare system. So one of the major points I'm going to make towards the end of this is what you can do for your individual self, for your family, to help deal with the catastrophically stupid systems that exist out there in our healthcare systems in our countries. And you may love your healthcare system, in which case you don't have to do anything different. But maybe at the end of this talk, you might not love it quite so much. One thing I'd like to point out is that the Democrats in the United States have long conflated the terms health insurance with health care. They flip those back and forth as if they're the same thing. Utter garbage, but it was very intentional on their part. They wanted to do that because they wanted to make insurance even more central to the United States healthcare system. I have no idea why they wanted to do it. I don't understand their methodology. I don't understand their thinking, but they wanted to do it, so they did that. I'm going to try to use terms very selectively and maybe ask you to start thinking maybe in the same terms, maybe in your own terms, but at least think of what each one means. So we'll start with some simple things like healthcare. What is healthcare and what is medical care? Are they two different things? You can come up with anything you want to, but this is how I think about it and how I'll endeavor to use the terms in the talk. Healthcare is what you do for yourself to maintain your health. And healthcare, and this is going to be a horrible thing for me to say, healthcare is a right. Why? Because healthcare is what you do for yourself, and it's free because it is stress reduction, sleep, diet, nutrition, and exercise. None of those have to cost any money at all, and you're not forcing anybody else to provide any of those for you. Healthcare is a right. Medical care is what you do when your health care fails despite your efforts to maintain your health. So your health fails because your health care didn't do the job adequately. Now you need medical care. And if medical care is a right, then you are supporting slavery. And probably everybody in the room understands that argument very straightforwardly. Medical care cannot be a right unless you support the ability to enslave other people to force them to do for you what you claim is your right. So I'll use health care to mean what you do for yourself, medical care for what you need to seek from others in whatever system you want to use, and health insurance is simply a third-party payer system. All right, so what about these parties? We always hear about the third-party payer system in the United States and the third-party payer system in Canada. What are these parties? Let's get this down because probably most people don't really think about it too much. First party is the patient. Second party is the doctor or the hospital system. Third party is some remote payer someplace. That third party can be your father. That third party can be the government. Third party can be an insurance company, or what these new things down in the United States called cost-sharing organizations, of which I've been the chief medical officer of 2. These are small and growing organizations. There are about 1 million people in the United States that are involved in these organizations, which are non-insurance methods for helping deal with the really expensive medical care that can hit you in the United States. So those are the 3 parties. Now, with that kind of basis, we're all on the same page there. Why is medical care in the United States, specifically, going to the half of the people who are in the US, why is medical care in the United States so expensive? And we all have our reasons. The most common question, when I ask that question, the most common answer I get is because of MRIs and high tech and these very expensive pharmaceuticals. Bull crap. It's not that. You name me one other sector, anywhere, in any economic system in which high tech increases the cost of the goods and services provided. You can't. There aren't any. And there's no reason why in medicine high tech shouldn't be reducing the costs too. There's something else. There's a different underlying diagnosis. And that underlying diagnosis, and I'm a doctor, so I think diagnostically all the time. What is the diagnosis? And I would propose, and other people have proposed, and Ron Paul has absolutely proposed and used the term repeatedly, the problem with the cost of medicine, both in the United States and Canada in a different way, is the term moral hazard, what we call moral hazard. I will use the term third-party payer problem. Moral hazard is an insurance term, and it may be better called subjective hazard, but let's call it the third-party payer problem for today, which is basically the simple thing that the first and second party, the patient and the doctor, are sitting there together in an office making what should be highly individualized decisions. Jeff was talking about government and local government and neighborhood and family and going from being a libertarian or an anarchist all the way down to a socialist in the family level. Well, now we're talking the individual human level. And when you're down at that level, it is such a personal thing with so many little variables coming into the decision-making process for the doctor and the patient, that why are we sticking in a third party at all into that? Why do we do that at all? But we do because of a variety of strange incentives that the government has created over the years. So the third party is sticking itself into a situation which should be the most individual process you can imagine. Now let's go a little bit further and think what an insurance company is, that third party. An insurance company makes its profits. It's completely incentivized by group collective outcomes. It doesn't care about an individual outcome. It only cares about the collective outcome. The individual doctor-patient relationship doesn't care about the collective outcome. It only cares about the individual outcome. We are sticking, in our situation in the United States and in Canada, we are sticking a giant collectivist ideology, highly incentivized towards collectivism. We're sticking it in the middle of this individual, what should be a perfectly individual situation. There's no way that they are compatible. There's no way that an insurance company mentality can function wisely within an individual doctor-patient relationship. And that's what we have done in the United States. And you've done it in Canada, just to government as opposed to an insurance company. So it's never going to work. So what are we going to do about it? Absolutely nothing. We're not going to be able to change this crap. It's a disaster, and it's going to be catastrophic. But there are little wedges of freedom that squeeze its way in. Are they going to take over the country? No. Are they going to take over even a good chunk of the country? No. But they can help us, or at least if you're in the United States, they can help you in the United States, these little wedges of freedom. One of the things that Obamacare did, the designers of Obamacare, they were clueless. They had no ability to diagnose the right problem. That's the first thing. They diagnosed our problem in the United States as there's too little health insurance. That's crap. There was way too much health insurance. The real diagnosis was that there's way too much third-party involvement. But they diagnosed it wrong, and then they used their government power to force more of the same toxic poison down our throat, which caused the problem in the first place, which is insurance. They took a very crony system, which we had prior to Obamacare, crony, fascist, whatever word you want to use for the medical system in the United States. They took that system and forced everybody to participate in that crony system. And that was their solution. Of course, it's not going to make it better. It didn't make it better. It's done nothing of value down there at all. But it has done one strange thing that they certainly didn't intend to do. The designers had no intention of doing this, which is the insurance companies, following their incentives, ended up causing the deductibles of most patients in the United States to rise higher and higher. Effectively, in order to afford insurance, you need to have a $5,000 deductible or something like that down in the United States. So these deductibles, in the past, a $5,000 deductible insurance policy would be called a catastrophic insurance policy. And go back 10 years, and a $5,000 deductible insurance policy might cost a family about $150 US a month, hardly anything. Now, of course, under Obamacare, those same $5,000 deductible policies are still going to cost $500 or $600 or $800 or $900 or $1,000 a month. But at least there are catastrophic components, meaning that $5,000 deductible, there's a free market underneath there. This little wedge of free market that the Obamacare people did not imagine they were creating. And following incentives, doctors and facilities and people who struggle for freedom in the medical world found a little place. And they've created all these little free market strategies down there in that little underneath the deductible place. Things like direct primary care. Anybody heard of direct primary care yet? There's one nod and a couple of nods. Direct primary care is a subscription model where it's like a capitation but at an individual level, where you pay a doctor $100 a month and they will provide all of your primary care needs, which for most people is 80 to 90% of everything you need in the healthcare system or medical care system is going to come from the direct primary care folk. And it costs you $100 a month, sometimes $50, sometimes $220 a month, depending on what doctor you go to and what their program is. There's about 3,000 of these direct primary care doctors in the United States now. Hardly enough. There's 600,000 practicing physicians in the US, 3,000 of them are DPC doctors. But seek them out, because they not only will provide all of your needs, they will provide it via text, via visual things, via telemedicine, via email, and they're not going to charge you any more to go 30 times a month than 1 time a month. You can go as often as you want, and you get this nice little package. And they will get you better deals on laboratory tests and radiology and subspecialty visits as well. They will help to negotiate your prices for all kinds of different things. And that's important, because the medical system in the US is so profoundly screwed up that there is no pricing signals whatsoever. And that's when there's no pricing, there's no competition, no functional anything. If you're a patient going to a doctor in the US and you ask him what something's going to cost, that doctor's going to have no idea, unable to tell you what some procedure is going to cost. You call the hospital up and ask them what's going to cost, they'll have no idea. They might be able to give you what's called the charge master price, which is these hyperinflated prices that are the top prices that the hospital will charge. The insurance companies all negotiate those down, but you as an individual have a tough time doing so. So I did want to talk about these charge master prices because, and I said that the prices keep going high, and I said it's because of the third-party payer problem, but I didn't really explicitly say why the third-party system in the US causes this problem so profoundly. So let's think about the first party, the second party, and the third party, and what they care about the costs of medical care. First party is the patient. 93% of patients in the United States have health insurance, medical insurance, whatever you want to call it, i.e. they have a third party protecting them from the financial aspects of their decisions. So the patient doesn't care about the cost, which is why, of course, the doctors don't know the prices, because the patients only very rarely bother to ask. So the patient doesn't care. What does the doctor or the hospital want the prices to be? They want them to be higher. That's the supply side. They want the prices to be higher. So you got a patient doesn't care, doctor and hospital wants the prices to be higher. How about that insurance company? What do they want? Do they want the prices lower? No. They want the prices higher too. And that's one problem, probably a surprise to you all. Insurance companies want the prices to be through the roof. Why? For 2 primary reasons. One, it justifies their existence. They don't pay these high prices. They have the power to negotiate down the prices to something that's more reasonable. So the further that delta is, if they can say that, without insurance, you'd have to pay $1,000 for this. With our insurance, you only have to pay $100 for this. We are valuable. And they can tell patients that so that they can recruit patients in and use it in their marketing. They can tell the governments that and say, look how important we are to reducing these horrible prices. So they love higher prices. And then Obamacare, in its infinite insanity, managed to make profits of insurance companies capped at 20% of their revenue. All right, well, that worked really well for AT&T for 70 years. You set a profit percentage for a company or a revenue part that they can use for their own expenses, whatever kind of caps you set or levels you set, the companies are going to go for that. So what's the best way to increase your, your profit or your ability to build things for your company, or build a new building or give your CEO a higher salary? Increase your total revenues. So prices go up in medical care, the insurance premiums get to go up, and they get more money to blow on their buildings and their expensive CEO salaries. So the insurance companies want the prices to be higher too. Thank you, Giant. That helps. So you have the three parties. One, patient doesn't care. Two, the doctors and hospitals want higher prices. Three, insurance companies want higher prices. What's naturally going to happen? The prices are going to go up. And that's the issue in the healthcare in the United States and medical care in the United States. That's why prices are so high. Not high tech. That's the answer. It's the third-party payer problem in a nutshell. So we are making these little wedges in here where the third-party payers aren't really involved in this very, very small areas of the medical economy. And I urge you to seek those out. And if you're in Canada, to start thinking about, well, the same problems exist up here, it's just that you've concentrated your third-party payer into a government socialist system. And it's not surprising, and I'm not even going to judge it. Right now, the United States is in a system where it has no answer for moral hazard. It has no answer for the third-party payer. We have these hyper-inflated prices that are going out of control because we haven't made the necessary choice to resolve this particular diagnosis. Moral hazard is the diagnosis. You need a treatment for moral hazard. What are the treatments? You need to reduce moral hazard. That's the first thing you try to do, to lower costs, reduce moral hazard. And there's two ways to reduce moral hazard. There's only two paths you can follow. One of which is to go free market all the way and get rid of third-party payers or minimize them entirely and say that the individual patient is going to make his individual medical decisions and pay for those medical decisions themselves. That obviates the third-party problem, and you get massive competition and reduced prices and availability, and the whole free market runs crazy, and we love it, right? That's what everyone in this room would prefer. It's not going to happen. Forget about it. It's not going to happen. But wouldn't it be lovely if it did? The other path to obviate the moral hazard and third-party payer problem is to likewise get the decision-making and the financial consequences in the hands of one entity. In the free market, that entity is the individual. The other way to go is the socialist system, where to eliminate moral hazard, you put the individual decision-making and the financial responsibility for that decision-making into one entity, the government, the taxpayer. So, and both of those paths will reduce costs. In Canada, clearly the prices are lower than in the United States and the costs are lower. That's because you've gone that way. And free market, I don't even know if it exists anywhere except in Thailand, Costa Rica, and a couple other places, maybe Grand Cayman. But we have chosen in the United States to make no choice, where we don't resolve the diagnosis at all. Now, in Canada, if you want to resolve moral hazard, like you've done and gone that path, you have to accept the fact that you can't make your individual choices. You can make some of them, little superficial things, but the big choices are going to be made by some kind of system and bureaucracy. Now try to get any kind of justice for yourself at the national level. Maybe you can in Canada, but in the United States, absolutely no chance of getting any justice at the national level for an individual. So if you have something that doesn't fit into the protocol that CMS just spit out from their offices where they manage their medical care out of Washington, D.C., and your individual situation does not function in that particular policy, you're going to die because of their policy. It'll take you 7 to 20 years to get your case up to have a 1 in 2,000 chance of being heard at the Supreme Court. You're going to be long dead before you can get justice for an individual at the United States government level. So if you're going to socialize or go for Medicare for all in the United States, just be aware that it's going to be entirely in conflict with the notion that the progressives have of seeking justice. It won't happen. You can't get it. So these two paths, the socialist path and the free market path and the socialist path, are the choices that we need to make if we're going to resolve the moral hazard for the countries. And I personally go the free market way. I'm not going to solve that for everybody. So all I can do is try to augment that little 5% or 4% of the economy, of the medical economy in the United States that doesn't have moral hazard, and trying to maximize that. And so I'd promote to you several different things to consider. Direct primary care is one. Medical tourism is another. You can come to the United States, you can go to Cayman, you can go to Costa Rica for dental work, you can go to Thailand for major surgical procedures, get them done better than you get in either one of our countries, or just as good, and get them for about 20% of the cost that you'd get them for in the United States. There's little websites popping up right and left to help get you to these places. You want to get dental work done for cheap? Go to Costa Rica. It's fantastic stuff, and nice little places that they'll set you up in, little hotels, and you go get your dental work done, stay for a week, and have a ball. You want to have cardiothoracic surgery done? Go to Thailand, go to Cayman. Go to these places where the free market is there and working for you. There's the sharing organizations in the United States. Most of them are Christian. There's one Jewish one. They're mostly Christian because Obamacare is one of the many things that it's weird about it, is that it's highly bigoted, in that the sharing organizations were created and allowed to exist within Obamacare only if they were Christian. It doesn't say that in the law, but that is the effect of the law, because the law only allowed these sharing organizations to function within the system if they existed prior to the year 2000. And sharing ministries, as they were called, were all Christian prior to the year 2000. And so these sharing organizations all say you have to have a personal, individual relationship with Jesus Christ. And one of them managed to make that relationship a little bit more distant because it's a Jewish organization, but it had morphed from a Christian organization. So these sharing organizations, the one advantage that they really have that's overwhelming against the insurance companies is that they're voluntary. You get together and you voluntarily share resources to help with these hyperinflated expenses that you're not expecting to have, but all of a sudden you get in an accident or you get cancer, and the stupid medical system with its hyperinflated prices is going to hit you with $1 million of costs. The sharing organizations can help the same way that an insurance company will help. But the sharing organizations are voluntary, and therefore, in the context of this conference, they're ethical because they are voluntary. I'm going to equate those two things. It's ethical because it's voluntary. And it's, they're growing fast because they're so much less expensive, in part because they're not regulated by the insurance companies. They're not required to have and can't have reserves. They can't have, and they just got to spend all the money as it comes in, so it's kind of a pay-as-you-go thing. And so they end up being a lot cheaper. They have a lot of restrictions. You can't get everything that you want anytime you want it. A lot of them will restrict, just like insurance companies do, alternative medicine. And that's something we can talk about too, alternative medicine, which is a really fun topic. But they're out there and they are available to you. Prescription drugs, out-of-control prices. What's the reason? Usually it's a government problem. In this case, there's a variety of problems. In the United States, we have our FDA. Talk about an unconstitutional organization that shouldn't exist and is counterproductive. You found it right in the FDA. The Food and Drug Administration, Mary Ruwart, who was a libertarian candidate for president back in 2008, I think it was she who calculated out that the Food and Drug Administration regulatory regime, starting in 1962, has saved 7,500 lives. Very important. The cost of that, in terms of lives, though, is that the very same regulations that saved those 7,200 lives have cost 7.5 million early deaths by the delay in eventually approved drugs caused by FDA. So these are drugs that eventually get on the market, but they were delayed by FDA. So that's a 1,000 to 1 death to survival ratio. The FDA should ban itself, and it should do it damn quick. So, and then on top of that, and how am I doing on time, Giant? 15 minutes. Cool. On top of that, we have another congressional stupidity down in the United States that created a process by which these creatures called pharmacy benefit managers can exist as an intermediary. Pharmacy benefit managers now are primarily, there's 3 large ones and then a bunch of little ones that together control about 82% of the prescription drug market. They produce nothing at all. They produce no drugs, they produce no science, they produce nothing at all other than contracts. And those contracts are between drug companies and pharmacies and drug companies and hospitals. And they involve kickbacks that are legalized specifically by Congress so that they can bribe the counterparty to their contracts. both counterparties to the contracts, and then they take a nice little piece off the top all the time. The major effect of the PBMs, I think, is to decrease the availability and supply and competition within the market. So there's a bag of fluid that we sometimes need to infuse into somebody who's particularly ill. It's sodium bicarbonate. It is baking soda. You take a bit of baking soda, you put it in a liter of water, you sterilize it, which is extremely easy to do. It would cost about a penny to make a bag of this fluid. But it'll cost $800 or will simply not be available from time to time down in the United States because of the PBMs who have inserted themselves and basically reduced the number of suppliers to one supplier in Puerto Rico that got taken out in the hurricane. So these organizations are very dangerous organizations, and they do nothing. You've heard of them, CVS Caremark. These guys have climbed up the beautiful stock returns, entirely unethical. You can make money on them for a while, but you know that you're basically leeching off the system by doing it. I'm not going to judge if you're, you can invest in those guys and they'll do you well. They recently had a little downturn because for a moment Trump had decided he was going to do things to interfere with the PBM's ability to bribe their contractual counterparties. But then he backed away from that under political pressure. He had other things to deal with. So what else can we do? How about this? You don't have to get your prescription drugs in the United States. You can get them in, quote, Canada, which a lot of people in the United States go to Canada to get their drugs. And I go like Canada because, as far as I can tell, maybe only one or two of these Canadian drug pharmacies are actually in Canada. That phrase, Canadian drug pharmacy, I've seen it out of companies in Singapore and out of companies in the BVI and every place else. They know that the United States trusts Canadian drugs, so they call their company Canadian Online blah, blah, blah. And I don't really care because I've learned to trust drugs reasonably well, as much as I trust anything from throughout the world. It's not like the Indian manufacturers who manufacture far more pharmaceuticals for their population than most of our companies do. It's not like they're trying to poison their population. They're pretty darn good drugs, and they cost a lot less. At one point, we were doing this anti-parasitic thing in Liberia, West Africa, and we wanted to treat all the kids in the country with this. All you need to do is give them one pill once every 6 months, and you can massively improve health. The pills in the United States is called albendazole. At that point, cost $350 a pill. A few months earlier, they only cost $8 a pill because there was another drug on the market called mebendazole. And mebendazole and albendazole competed. Now, the pharmaceuticals company that had control of mebendazole took it off the market, not because it was a bad drug, but because they have a cancer indication for it now, and they wanted to pull it off the market so that they could, when they put it back on the market for their cancer indication, they could charge $50,000 a pill, or whatever they feel like choosing, all right? But, so mebendazole came off the market. Albendazole went from $8 a pill to $350 to $800 a pill. And we had, at this time, just ordered from China, 650,000 of these albendazole pills at 1.2 cents a pill. And I had these in Canada, in Liberia, and all of a sudden I realized, now, yes, I can understand that this wouldn't actually happen, but all of a sudden I realized that I was sitting on something like $250 million in Liberia. And it's like, that's like the whole GDP of the country. So these are really strange perturbations. And so another thing you can do to help the world is to get into the black market, to be a rum runner, to run these drugs across international borders illegally. Go for it. The more you do, the happier we'll be. There we go. Then it's not like we can't test these drugs to make sure they're not all like filled with melamine and cyanide. It's very easy to do tests on these drugs, but there's no company that has yet built it in the United States. So here's something else you can do, or in Canada for that matter. Go ahead and start a company that is going to make a little device that can go to the pharmacies or to the individual houses that you stick the little pill in and it's going to spit out what's in it, so that you can source your drugs from anywhere you want to and know what's actually in it. This technology exists. It's not hard to do. You can centralize it. You can make it a distributive effort by having it in households. Somebody start a company and do that. I have too many companies. I'm really tired of starting them, so I'm not going to do one. But what else can you do? How about this? How about this idea? Throughout the world, prescriptions are not always necessary. As a matter of fact, most countries, you don't need prescriptions to get drugs. And I don't mean opiates, I mean anything, like cholesterol-lowering drugs. You just go to the pharmacist and ask him for such and such, or ask him for some advice. In the United States, pharmacists go to school for 4 years. And what do when they go to practice? All they do, and I'm serious, all they do is fill out insurance forms, call insurance companies, and count pills. You don't need 4 years education for that. Pharmacists are highly trained, very competent professionals, and that's all they're relegated to doing. How about this? And it won't happen. Eliminate the need for prescriptions. Why do you need to go to have a doctor as an intermediary for going to get your cholesterol pill, or for 20 years Claritin, the safest drug ever made by mankind? You had to get a prescription. Why? It's so that there's no price transparency and all these stupid systems can exist. Doctors, in the United States at least, are 40% of them consider themselves socially liberal and economically conservative, i.e. libertarian-ish, 40% of them. And yet you ask doctors to give up that monopoly on their prescription pad, and they will fight you tooth and nail, every single one of them. Very rarely will you find a doctor like me who wants to get rid of all prescriptions. They'll fight you, even though they're, quote, libertarian. They want their monopoly. And not only do they want their monopoly so that no other professional can do it. They call them doctors. Doctors are like nurse practitioners and physician's assistants and others. And they'll use that pejorative term to try to prevent those people from having prescription privileges too. It's all stupid. I mean, why do you have to go to a doctor to get your cholesterol refilled? He can look up and probably know more about the cholesterol pill than the doctor will just by going online. But the doctors insist on being paternalistic and taking care of you. And so they do that. You're not going to get these things changed, but wouldn't it be marvelous if we could eliminate FDA and just use a UL listing for drugs? UL listing works really, really well for a ton of different things, and it's private, and there's incentives to get the UL listing because you can't get your liability insurance if you don't have the UL listing. Do that for drugs. Get rid of the FDA. Get rid of the prescription pad. I mean, maybe keep it for antibiotics, because antibiotics, if you take an antibiotic wrongly, it could adversely affect you. But pretty much anything else, if you take a drug wrongly, you're the only one who's going to be suffering. So there's good incentive for you to learn on your own. You don't need the doctor to tell you. It doesn't mean you can't go to the doctor and get the doctor's advice. Walk in and go get the doctor's advice. Give him $25 and he'll give you advice. Or in the United States now, give him $250 and he'll give you the advice. But in the free market, it will only be $25 to go see a doctor. But that's not going to happen. None of that's going to happen because we can't make it happen because, and I think here's the reality, is that people aren't thinking. They're not thinking about it. They don't realize it. They're emotional actors. They're human beings. They're not thinking about it. There's no ethics really much left in North America. There's a few people who have them, but for the most part, ethics has deteriorated to the point where people don't know that it's wrong to force people to do things that you want them to do. And when they don't know, when they're not taught, matter of fact, they're taught the opposite. They are taught from kindergarten that it is appropriate to force people to do what you want them to do. When that is so permeating society, none of these positive changes are going to happen unless you escape society and make your own little file, P-H-Y-L-E, where you live with and you associate with the people who are ethical. And you may be able to find a file, a little group of people who might amount to a little tiny group, like maybe 10 million people in the United States, who can all join together and have their own little economy and say, to hell with everybody else. You guys can play, we're going to play our ethical game, you guys can do your stuff, and move on. So those are the ideas that I have. Not good ideas, but anyhow, I'd like to open it to questions if I have 2 minutes left or 5 minutes.
Sure.
Any ideas, any questions?
Hey, John, thanks. I'll keep it short.
Oh,
I'm just wondering if you could give me an idea if you see any particular impediment to a hybrid system that has both public and private healthcare providers.
Particular impediments?
Well, you said that there's two ways to go. One would be, strictly straight free market, and the other one would be socialized. Can these coexist in tandem?
Well, those are the ways to eliminate the third-party payer. You can certainly have private systems where you have total individual care, and socialized systems where you have voluntary signing up for voluntary funding of and voluntary signing up for Medicare, or equivalent in Canada. Those things can be side by side, but the key element is you have to have the individual making the patient and bearing the responsibility for the costs, or the government making the decisions and bearing the responsibility of the cost. And then it would be great if the people can choose which path they want to go to, and if the socialist system doesn't coerce those who join the individual system to pay into their boondoggle. But that's going to be the challenge, is how do you get the socialist system paid for as a voluntary system? And no one's going to propose that. The coercive nature of it is heart and soul of the socialist system. And yes, you can have socialism in a family. That's not coercive, it's voluntary, or friend group. I have nothing wrong with voluntary socialism, but it's almost a contradiction in terms. Voluntary socialism is also cooperation. Big fan of that. But the coercive nature makes it unethical. So I can't choose to go to the socialist pathway simply because the coercive nature of it makes it unethical. So there is a way. I don't know if it's going to be found.
Can of worms question. BC Medical Association limits the number of doctors that we have, and we have neurosurgeons driving taxis. Is there any way of breaking the monopoly of these control systems, and would that affect, in your experience, the quality of care that we would get?
So thank you for the information. I have a similar thing. I was giving a talk in Poland some time ago, and my translator, because my Polish was failing me, my translator was a wonderful pediatric surgeon who had something on the order of 28 years of training, which is the same amount that I had. And she was my translator because she made so much more money as my translator than as a pediatric surgeon. Yes, of course, if you get the government out of the way, get it out of the way, stop doing these supply controls, of course it's going to make things better. Not all doctors are good. There's a lot of morons out there, and there's a lot of whack jobs out there. But with modern tech, we can start rating those people. But also with modern tech, be aware of alternative. Alternative means unproven or insufficiently proven. You should not be paying very much money for alternative because it's not very proven. And just keep that in mind. I don't have anything objection to alternative otherwise, but know that it should be cheap. There's a new set of creatures called functional and integrative doctors. I shouldn't call them creatures, but it's an alternative, but they might have an MD or some other degree. And what their shtick is that they're scientifically based. They have 40,000 papers supporting their efforts. They charge $1,000 if you sneeze for a whole bunch of lab tests. Actually, what they do is they order $1,000 of tests. They charge you $5,000 for those tests. And then they give you a bunch of supplements and pharmaceuticals in a mixture and really heavy-duty polypharmacy. Very, very expensive form of care. And they've got but they say they're scientific because they have 40,000 papers. So last night I was online looking up just a bunch of stuff on PubMed, which is scientific journal articles. And I found 1.5 million papers supporting the clinical value of waffles. So there's 2.5 million papers being published every year right now in the scientific literature. You can find anything to support anything, and you can claim to be scientific. Be very, very cautious. The allopathic world is also filled with people who aren't following science, so be cautious.
Just one very quick question, please.
Oh, sorry. There's another man over there.
I live in New Jersey. We do have direct pay. And so you give your primary maybe $2,000 or $3,000, not $150 a month, but it doesn't get charged you $2,000 or $3,000. That's fine. But what happens when you need a specialist?
Yeah, there's no system in the U.S. yet for having direct access to specialists. I shouldn't say there's no. There's some companies that are trying to make direct access to specialists. They're just building. Keep an eye out for them. They'll come.
Sorry, we have run out of time. Thank you,
sorry.
John.
Thank you all very much.